everybody. We are here. This is one of the first video discussions that we'll be doing under this new really program about dementia and families. I'm specifically really trying to focus on families of color, really specifically within the Black culture, because we just have such a different experience. We just have such a different background and things that impact how we deal with anything related to mental wellness. Right. So I'm going to get right into the conversation. Like I said, this is one of many, and I am so blessed and honored to have my first conversation like this with a good friend of mine, supporter, Dr. Mina Garrett-Scott. And yes, and I'm gonna what's so interesting about this, I reach out to Dr. Scott for basically anything related to medical wellness, health, all of that. But what I didn't realize is that, Mina, you're actually dealing with this topic yourself. It's very raw and new. So again, appreciate you taking time to have the conversation. I think this is going to be really beneficial because one, you're coming at it from a caregiver yourself, but you're also coming as a doctor who is a caregiver, and you're Black. You have it all. So
all the angles, Lita, all the
exactly.
angles.
So first, we just have you kind of just again say, what you do, and I know I say Dr. Garrett-Scott, but just let everybody know a little bit about who you are.
Yeah, absolutely. So I am a family physician, and I work at Herndon Family Medicine and Inova partner practice in Herndon. And I have been a family physician for almost 23, going on 23 years. And what a blessing to look back over a career well spent, caring for my community and being present for people who need me. So I have a passion for family medicine, and family medicine doctors take care of the family from birth through transitions to adolescence, through adulthood to death. So we cover the family from every age category and are able to help families navigate very sticky situations, including relatives with cognitive impairment and dementia.
Wow. Well, again, appreciate the work that you do. And like I said, we'll get into the conversation. So for those who are, just kind of seeing who I am, I'm the founder of a new nonprofit, which is My Natural Me. I've been doing the work for a long time, but we just made My Natural Me an official nonprofit. And one of the programs that I wouldn't have even been anticipating starting, but the first kind of program that I'm focusing on is around support for cognitive impairment, especially for those dealing with dementia and Alzheimer's. And I'm doing that because I'm experiencing it myself with my mom. And it's been a very interesting journey. And I just want to talk about that. Within our experience, it's been now, my mom started having symptoms probably about 4 or 5 years ago. And my aunt was actually the first person who brought it to my attention. She called me one day and she was just so upset. And she was like, I think something's going on with your mom. And I'm like, what are you talking about? And she's like, have you noticed that she's been forgetful? And I'm like, it's mommy. Like, I don't know. You just don't tune in. So she was like, yeah, I think something's going on. A few months went by. I didn't even really pay much attention to it. And then she called me again and she was like, your mom did not remember my grandson. And I was like, what do you mean? She's like, every time we get together, my mom and her sister, they're very close, best friends. Yes. And she's like, every time we get together, she always asks me, well, how is Boo's son doing? How is this? She was like, and I started talking about him and she just couldn't place that Boo had a son. And I was like, and again, she got emotional. She was like, please get her to the doctor. So I was like, I don't know what to do. So we went to the primary care doctor who said, see a neurologist. And so we did that, I think that's what you'll correct me if I'm saying the wrong terms. I think it's called
Yeah, yeah,
yes.
neurologist. Absolutely.
Yes. And
I'll be
so
the next person in the care team.
yes. And so they do, this test, like draw the clock and everything,
Mhm.
which my mom did pretty good. One or two things were slightly off, but at that time she said, well, I see a little mild cognitive impairments, but let's just see what's going on. The pandemic was kind of just getting ready to get started, like if we were just starting to hear about things. So she was like, go to the library, do things to keep you active and you'll be fine.
Yes.
Well, shortly within a few months, my aunt passed away. And my mom just, when I say like she declined so rapidly, it was just, she grieved so much the loss of my aunt. She stopped eating. To date, my mom has probably lost like close to 80 pounds.
Wow.
But she just stopped eating, and and then we went into the pandemic. And so there was like, the first year where there was no vaccine. We were everything was shut down.
No contact.
No contact, right? So my mom is grieving. No, we can't really do anything to help her. We would come to the house and like stand on the sidewalk and like wave.
Right.
It was terrible.
And that is the worst thing. Social isolation and lack of normal routines. Worst thing that can happen for someone with cognitive impairment. And if you see them sliding before that kind of thing happens, our senior community, they really had a rough time with the social isolation, the lack of connectedness, the lack of routine, the lack of ability to connect with family and friends, which really is a mooring force in a person who might have a little bit of a memory deficit and just need those memory jogs and relationships to kind of keep the memory kind of intact. Oh, wow. That pandemic, it really, really had massive effects on patients with cognitive problems. Absolutely, memory problems.
Yeah, and that's what happened. And then things kind of opened up after vaccines came out, and we could kind of get together a little bit more often. The way she declined so rapidly. And what was the turning point for me? Because and I'm like I said, well, I know we'll talk a little bit more about it, but I feel like there's stages of it, right? And all of us kind of have our different stages. And I'm the oldest of my mom's kids, so I'm always kind of the one that everybody just like, you handle it, And so I was kind of
I get it. I'm the oldest too. Sis, it's broke. You fix it. I'm like, wow. What are y'all gonna do? No.
these appointments, but even I am kind of like, well, maybe once she finishes kind of healing from my aunt. And the turning point for me, we had went to the store and we were laughing, talking. Again, most of the time she seemed good. This particular day, I got her out, we went to the store, laughing and talking, and we went into the store, came out, and this woman was like walking her like 4-year-old in front of the car. And so my mom loves kids, and she goes, oh, look at the little girl. And it's like that's typical. And so then she says, man, that makes me think about my daughter. And I'm kind of like, I'm at the steering wheel, and I'm like, don't you think of your daughter? And she said, Lita, she lost the baby. And I'm sitting there like, I am Lita. And I'm like, I said, what, mommy? And she goes, Lita, wait a minute, was it Lita or Jessie, which is my sister? And it was Lita. She said, she's just so broken up about it. I feel so bad for her. And I when she said about the kid, I knew something was off, because since the miscarriage, my mom had been like, it was like she didn't talk. We kind of just didn't really talk about the kids.
Thing. Right.
Yes.
Right.
I was like, it was like 30 minutes. I actually pushed record because I'm like, I need to be able to show this, because I knew my sister would be like, well, maybe no, I need you all to see this. I need the doctors to see this. It was 30 minutes and she was looking at me, and it was just the most bizarre thing to experience, because she knew I was someone that meant a lot to her, was close to her, but she was not connecting that I was her daughter. And
Yes.
even I had like a badge hanging in the car, and she looked at the badge, which has my name, and she's like, "Did I name my daughter after you?" She got so confused.
Rita,
It was
yes.
oh my goodness. So that was like the turning point where I was like, this is real.
Mm-hmm.
This is real. So
Mm-hmm.
that's kind of how we got here, right? And this has been a
Yes.
journey, but I'm gonna kind of turn it over to you and just again, if I don't know if you want to start with your own journey as the caregiver, as the doctor, as both, but yeah, I'm turning it over to you.
Absolutely. So similar kind of situation with my mom. So we live here in Northern Virginia, Lita, and my mother was residing in Southern New Jersey, my hometown, in Egg Harbor Township. And my sisters are still up there. So they were primarily managing her finances, helping her to get to doctor's appointments, really sort of assisting with all of her day-to-day care. And my middle sister, Keisha, closest to me in age, just started noticing some quirky things, like repetitive questioning, forgetting things like where her phone was, lack of ability to find her keys, just a lot of difficulties with executive functioning, like keeping up with bills, keeping sort of paperwork in an organized fashion, and just needing a lot more assistance with activities of daily living. And got to the point where there were even some mental health concerns about auditory and visual hallucinations in her apartment. And my sister was fearful that perhaps there was something going on as far as brain health, and whether there was some underlying disease process like thyroid or a tumor or something. So she called me one night in a panic. Like, mom called me, she was completely confused. What do I do? And I said, you know what, take her to an emergency room, because I don't know whether we're dealing with some chemical issue, whether there's a major tumor, like what the underlying disease process is, because some people can present with, their first cognitive symptoms related to illnesses like urinary tract infections or sepsis, or neurologic conditions like brain tumors, right? So you sort of need to kind of jump on it if someone has an acute drop in their normal baseline functioning, to make sure that there isn't some reversible cause of delirium or cognitive decline. So that was the first concern when my sister called me. I'm like, okay, nope, y'all go to the ER. I'm not there and I can't assess the situation, and we got to make sure the mom's okay.
Yeah.
And what was crazy, everything was perfect. Blood sugar was perfect, thyroid was perfect. They didn't find a tumor. I'm like, and like, you all, not that you want something bad to be found, but in the back of my mind, I'm like, yeah, this is going to be a long journey, because it's dementia, right? It's dementia. So after, the ER visit, my sister really was struggling, trying to get her back and forth to doctor's appointments and finding neurologists, psychologists, psychiatrists who were installed in the South Jersey community who could see her acutely. I do have some classmates and friends still in the area that were instrumental in getting her seen and starting medications to help stabilize mood and just get her comfortable. But my sister decided that the care was just becoming too much for her, and called me one day and said, "Tag, you're it." So literally, I in the dead of the early morning hours 3 weeks ago on a Saturday, drove to New Jersey and had a frank conversation with my mom about her not being able to stay by herself anymore and needing a little bit more support, and giving her choices. So when we're dealing with a person with cognitive impairment, they're still a person, an adult with dreams, desires, goals, and things that they want. But you're, as the adult child or adult family member helping to advocate for them, you're seeing the fear, right? That, are they going to hurt themselves? Are they going to leave the stove on? Is something bad going to happen? What are we going to do in the crisis situation to keep them safe? So I had to navigate that whole, okay, I got to get her safe. And my goal is to get her in the van, right? Pack up everything and just go down south.
Yeah.
But I had to also make sure that I was honoring her and, making sure that these choices that we were making in duress were choices that she was comfortable with. So I didn't come to her and say, Mama, you get in the car.
Yeah.
Like sometimes culturally, right? We're very gregarious people, and it's just like, let's get done what needs to be done, right?
Yeah.
But she's still my mama, right?
Yeah.
She's still in there, albeit sometimes not, right? But she's still. So I couldn't come at her with that disrespectful, I'm the doctor and you have to do this tone, right? I had to be her daughter and explain my concern and ask her what she wanted to do, even though I knew, cognitively she couldn't stay by herself anymore. And thank God in our situation, Lita, she said, yeah, sure. She was realizing that she had gotten thin. Her siblings were noticing that she wasn't keeping up with meals. Like we had, she has 7 brothers and sisters, and they were all like noticing, right? And calling and expressing concern. So I thankfully had that level of intervention from other family members who were supporting this journey between the two of us and me encouraging her to come south.
Wow.
And she's here.
Wow. And I'm so glad that you talked about that, because around the culture, because it's twofold. One, like you said, our culture, we get things done, we jump in, strong Black women. And I think what's important to note is, like in the case of my mom, she's been that person. She's been the strong Black woman. So for my mom, that's definitely been a part of the challenge, because the depression comes in as she feels like she's losing that. Like my mom was the person who was on point with her finances. In fact, she would do like the family's taxes. So now that she won't remember month to month that my sister came over that did the finances, and that depresses her. So I love what you said. I think it's so important, and it's hard because it's hard for us to think about their safety, but also give them that respect. But I can't say enough, again, I don't have the medical background, but from the personal experience, it works so much better when you involve them in the process. It's showing them they still have it. We're respecting them. And my mom has said, don't discount me.
Yes.
Right.
And she will look me in my eye and tell me, you're the daughter, I'm the mother. Your mother. And that has been the level of respect and sort of that our relationship my whole life. And it doesn't matter whether I have an MD, a PhD, a player haters degree. She don't care about none of that, right? She birthed me, and there is a level of respect. And biblically, if we honor our parents, our days on this earth will be longer. These are parables that are truth. They are truth. So we have to first put that in the responsibility in those relationships when we're making these decisions. It is like my dad would always say, you can lead a horse to water, but you can't make him drink. If you are forcing a person to do something against their will, there's going to be a lot of resistance. So there has to be some level of understanding, respect, discussion, not just cutting the person off and not honoring their desires. My mother left town and she had an adult relationship with a man that was not my father. My father passed away. Wonderful. But I had to talk to her, Mom, how is that going to feel leaving him behind, right? When they've had this friendship, this kinship, this relationship for, a decade, right? Since my father closed his eyes. And, I think just having those open conversations, daughter and adult mother, right? She didn't feel like I was dictating. And she felt more open-hearted. And I mean, I say prayer works, because when I tell you that when all of this was going on, being on my knees before God and asking for guidance and direction so that my spirit was coming from the right place, so important. Because if I went down there acting crazy, it would have been a mess. With my sisters gag, and her sisters gag. Everybody had an opinion on what had to happen. But I needed to make sure that we were on the same team.
Yeah. Something else that I noticed with this whole process, I went to a few of the group supports, and I was one of the only ones that looked like me from an age standpoint and a color standpoint. At least, and again, I can only speak for Northern Virginia experience, right? But the majority of people in there were older white people that they themselves were like 70s, 80s, because they would
Right.
be with like partners, or their parents were like in their 90s. So
Mm-hmm.
one of the things I want to do, and for those who are watching this, please reach out, because I want more support for people like us, right?
Yeah.
We're young still, and we're dealing with youngish parents, right? Who
Yes.
we have
Yes.
to, it's like, again, it's this different dynamic. And one of the things I want to get your opinion on, or your feedback, I remember when I went to these different sessions, and I
Mm-hmm.
said, well, when she asked questions, like she would ask about, my aunt, for example, who had passed, did you
Mm-hmm.
talk to your aunt? Things like that. So the recommendation was, you don't want to upset them. So basically, this is not the words they use, but it's basically like, be dishonest, in the sense, like if they say, well, whatever it is, basically in a way kind of placate, so you don't upset them by telling them the truth.
Mm-hmm.
I understand that in principle, but I'll tell you something that happened. My mom, maybe a month or so ago, called me, and she was asking about where my sister was,
Mm-hmm.
and me. But again,
Mm-hmm.
she was thinking of us as kids.
Yeah.
And so she's like, I don't know where the babies are. Where She was so upset. I mean, just hurt. She's like, are they with you? So I was like, I said, oh, mommy, they're fine. And she
Mm-hmm.
said, oh, good. I've been so worried. I asked Benny, which is my stepdad. I asked
Mm-hmm.
Benny where the girls are, and he said they're at home. So I'm just so they're with you. They're fine. And I said, oh
Mm-hmm.
yeah, they're fine. What do they do? And she like went on. She's like, what are they doing? Playing in the yard? And I'm like, oh, they're fine. I just kept repeating that.
They're fine. Right.
I thought that was
Reassuring.
the right thing to do. However, hours later, I mean, she had gone out with my stepdad, came back home. Hours later, she called me, still in that place of, the girls are with you. And I'm like, this just does not feel like it's the right thing. And my mom, I mean, she calls me probably at least 10 times a day, because she knows whatever role she sees me in that moment. Sometimes I'm her sister, sometimes I'm, I guess, like a good friend. She
Mm-hmm.
always knows I'm the one that's going to be truthful. I'm the one that's going to help her. So if I ended up having to say, like, I'm going to call my sister and let's FaceTime, because I don't feel right going to bed with my mom still
Right.
in this place. So
Yeah.
we call her FaceTime, and my mom just was looking at me, and she's like, and she kind of snapped, she came out of that whatever vortex she was in. But I
Mm-hmm.
mean, honestly, I felt like I was betraying the trust. Like I was just, so what's your feedback on
Right.
that?
So it is really case by case.
Okay.
So Lita, in the middle of, you guys being at a social event, and if she's having a moment where just remember things, gentle, soft, kind of placating in the moment, it's probably okay.
Okay.
But, you do want to sort of, when you're in the comfort of home, when she's in an environment that she's comfortable in, when she, kind of knows everybody loves her and she's safe, just gently saying, oh, mommy, you were asking about auntie, auntie passed away, right? Do you remember? Like just gentle. And the person, unfortunately, is reliving that death every time you remind them, right? Or they're going back to your childhood every time you remind them that you're an adult. It is so challenging.
Yeah.
And you know what, if they're in a happy place in a moment, right, which is socially appropriate and not going to cause a mental meltdown and a hard moment, then in the moment, just leave it alone, right? But gently, remind, like, I remember my mom kept asking something about, like, what was she saying? It was something about my niece. Oh, Zizi's upstairs. Where's Zizi? Is Zizi, like she kept asking about her. Is Zizi down here? She's, like my sister's still transitioning to maybe move down here too.
Yeah.
And I kept saying, oh yeah, she's okay. She's coming back. We'll see her in a little bit, and I mean, in the moment, that was the right answer, and it made her feel comfortable, and that's okay. There's nothing wrong with it. But coming back to okay, let's talk about reality. She's reliving that. She's reliving those moments, and we have to be gentle sometimes and kind of reintroduce truth. And
Yeah.
it's hard. It's hard because they really forget. They really forget. It's very, very challenging. I mean, there is some humor in it, right? It's like I said something about like my mom will be transitioning to Arbor Terrace, like I mentioned, which is an independent slash assisted living facility here in Dranesville. And she constantly in this house is losing her phone. Now I'll tell you, this house eats things. It's a pretty big house, so I've lost my phone too. So I understand.
Right.
So we ended up replacing the phone because it had some issues, and and I said to her, now you have a phone and I can send you out of my house. And she was like, we're teasing back and forth, and she's like, well, I'm only going to go over there to Arbor Terrace and lose it, and you're going to have to come over and find it for me.
Oh.
Like, this is crazy. You
I
have to find the humor, because if you don't laugh in the moment and you get wallowed in self-pity about the situation, you're going to cry and crash. And this is still your parent. This is still your loved one.
Yep.
They are still in there, right? And you're going to have moments where there's great joy as you see them interact with the grandchildren and call them your name, right?
Yes.
They're not you. And
Yeah.
it's actually kind of beautiful, right? To see them weaving those relationships in their mind. And although they might be a little discombobulated, they still know they're loved.
Yes.
And that's the most important thing.
That is, and I remember, my therapist said to me, because at one point during this process, I was just trying to get everything right. And my therapist said to me, you are not an expert on dementia.
No.
And I remember when you and I were talking about doing this conversation, you shared that was kind of a challenge for you because you are a medical expert. You've probably can't even count how many patients that you've had to have conversations with about the steps for dementia and all that. But when it hits home,
it is a whole different ball game. So Lita, like, okay, what do we do? What level of care do we need? Like, I mean, I'd had conversations with families about levels of care and filled out admission paperwork for various stages of care, right? From independent living to group home settings to assisted living to full-blown, full-time nursing care. But I never had conversations about what cognitive changes needed to happen at each level to require which types of services, and then how the cost looked for families. I mean, this was, whoa. I was like, it's overwhelming. It's overwhelming, and trying to find services is just, it's difficult. There's no textbook. There's no textbook out there.
No. Well, I think the couple of final things that I want to address, and hopefully we'll have more of these conversations. Again, I know we're navigating through it, right?
Yes.
So we'll have
a work in progress.
Exactly. If you could just touch on, for those who see this and they've noticed some changes in their loved one, they're seeing the signs. If you can just kind of talk about, what the steps are, like, going to the doctor and kind of what it would look like, what kind of things do they need to do?
Absolutely. So if you're seeing your loved one start having some cognitive impairment, memory loss, right? They can't keep track of their finances. They're having trouble with managing their medications, their activities of daily living. They may not be eating or keeping up with their meals. They may lose things constantly and be, kind of searching for things. Any of those signs that memory is a problem should prompt you first to get to your primary care doctor. That's a family doctor, an internist, a nurse practitioner in primary care, a PA. Need to get to that primary care physician and make sure that what I mentioned, those reversible causes of delirium, aren't bothering them. Sometimes people have uncontrolled high blood pressure, and that can cause vascular changes or vascular dementia. Sometimes people can have uncontrolled blood sugar, and correcting blood sugar can improve their cognitive function. Sometimes depression can look like dementia, and treating someone who may have a mental health concern or underlying mood disorder is really important. And those are things that can be teased apart, by a primary care physician or primary care provider. If all of the the boxes are checked for all the preliminary checks. Their thyroid's healthy, they don't have sugar, their blood pressure's okay, sort of all those reversible causes have been ruled out. Then the next step is probably to see a neurologist, or geriatrician, who is a doctor that specializes in care of elderly patients, or a psychiatrist or psychologist that does cognitive testing to figure out what flavor of cognitive impairment the person has. Neurologists and these providers will be very good at teasing apart, is there an underlying mood disorder? Do we need to treat that? Is there underlying, dementia, and what flavor and what medications might be helpful and help things to slow down these cognitive changes? There are medications on the market like Aricept and Namenda that can sometimes slow down the progression of certain types of dementia. Also, just understanding how cognitive changes are affecting the person's activities of daily living will help the neurologist, the psychiatrist, the psychologist install people, support network, whatever is needed to help kind of bolster the person's life and make sure that they're in a safe living situation. So, then we have to talk about the nuts and bolts of everyday life. Does the person stay in their house alone with support, with, a nurse coming in a couple times a week to check in on them? Are they taking their medicines regularly and appropriately and on time? Do they need to be in a facility where they're being monitored? These are all questions that sort of need to be teased apart between the primary doctor and the brain doctor, the neurologist, the psychologist, the psychiatrist. It is a whole thing, and it kind of takes some time. Sometimes it is a year or more before someone comes to a diagnosis of dementia, right? And then figuring out what flavor and what services need to be installed. It's a process. But your primary care is a great resource to sort of start the process and looking into why the person is declining.
Wow. Thank you so much for sharing that. And you're right. Even with all the symptoms my mom was having, it was about a year of the process, like you said, going to the primary care doctor, getting the testing done, getting that cognitive testing done, MRIs, CAT scan, all those things before they finally landed on, what she was dealing with. And I will add, understanding, like you said, the flavor and what it means, because when they gave the diagnosis, they said she was in, it may not have been the word stage 1, but it was like mild dementia or something along those lines, right?
The mild, moderate, severe, right?
Yeah. So
I'm like, I don't know, Lita. I don't know myself.
And
I can't
see, that's
I can't wash myself.
Yes.
Right. So
that's so important because, again, my sister and I looked at that, and my sister was like, "Oh, great! So it's not that bad." And I'm like, sometimes she's not even knowing who I am. So I called the lady back and I said, "Listen, you're on this report. It's saying that it's mild dementia, equivalent to like the first stage." And I said, "But this is what's happening." And what she said to me is important. She said, "We can't even diagnose dementia unless there's severe cognitive impairment."
Yes.
And
yes.
I'm like,
so
why don't I look at
Right, you'll read all these articles about tau protein, right, and neurofibular tangles, and the way we arrive at the diagnosis of like Alzheimer's, right? Where are you going to find a tau test? Who's going to do a spinal tap on your mama and say she got protein, and that's the kind of who's going to do a special PET scan with markers? You can get that kind of care maybe at Mayo Clinic, Johns Hopkins. Is insurance going to pay for it? Probably not. So you're left to specialists who have experience with the types of dementia that are out there, and looking at the person's medical history and seeing what may have triggered their cognitive impairment. Listen, hypertension, the second leading cause of dementia, vascular dementia. So if you out there have hypertension that's not being addressed, you need to see your doctor. I mean, this can be a major trigger for, loss of cognitive points as you get older. Alzheimer's, of course, is the most common. Practically 60 to 80% of dementia cases are related to Alzheimer's. But right now, that's mostly a postmortem diagnosis, meaning we find it once the person's passed away and maybe we do an autopsy. We're not routinely getting PET scans and, taps for tau proteins in the cerebral spinal fluid. Even though the technology is out there, it's not widely covered by insurance and not widely available to figure out the type of dementia the person has. So it's really up to the neurologist, the primary care, in managing underlying medical conditions and, giving the diagnosis, based on the person's presentation. It's a whole long, drawn out, very detailed workup to try to come to an understanding of what's going on in the brain and how to best manage the person's symptoms.
Yeah, wow. Okay, one last question. I had actually done a video where I attempted to explain the difference between dementia and Alzheimer's, and someone actually corrected me. So I took that video down. I felt like I understood it, but this is such an important thing that I don't want to miss speak.
Yes,
So
let's talk about it.
Professionally, what is the difference?
So just like there's flavors, strawberry, banana, chocolate, there are different types of dementia, right? And Alzheimer's is the most common type of dementia, or common type of cognitive impairment. It is a type. And it involves something called neurofibular tangles and plaques in the brain, where the brain starts to make these proteins called tau proteins and amyloid that cause tangling of the neurons, which leads to plaques in the brain and reduction in memory and cognitive function. So Alzheimer's is usually implicated in about 60 to 80% of dementia cases, but there's other types. There's vascular dementia, as I mentioned, which is the second most leading cause of cognitive decline. And usually those cases are triggered by hypertension. Uncontrolled hypertension over a lifespan can decrease blood flow to critical parts of the brain, cause atherosclerosis and hardening of the arteries in the brain, and lead to cognitive impairment. So vascular is another. Parkinson's disease, alcohol, Lewy body. There is a whole compilation of different types of dementia. So trying to understand which type your loved one has may be important and may have implications in how they're treated. So you weren't completely wrong. Dementia, Alzheimer's is a flavor of dementia. There are many different types of dementia, and kind of figuring out the type that your loved one has may affect their treatment.
Thank you so much. Wow. Well, I know your time is very precious. Like you said, mom, wife, daughter, caregiver, doctor. You're doing it all. So again, I appreciate you stopping by. Again, having this first conversation. I cannot wait to really build this program out when the Women's Center opens up, especially prayerfully the end of 2023. I want that space for us to be able to come and talk about, and whether you're a physician, whether you're your average Joe, no matter what, I really feel like we need spaces where it's like, this is our time to just talk, deal with, share experiences. And I can't wait to have that. And I know you'll be connected in some kind of way.
Yes. Oh my gosh, Lita. I mean, I think just culturally competent medicine and meeting people of color where they are and understanding our unique health issues, our unique community issues, our unique mental health concerns, so important, right? And, I'm so passionate about meeting our people and being a resource and helping to educate. And I'm so excited about the work you're doing. Oh my goodness, just that the Lord has smiled on me and kept us connected all these years is such a blessing. I'm so happy.
Thank you. Thank you so
Happy
much.
for you.
I could go on and on and on, because you just have no idea how much you mean to me. But look, the people don't want to see. They don't want to hear about all that.
Lita, so a prayer that I say on days when I'm tired, and when you're caregiving, you do get tired. And I wish I could remember the scripture reference. I don't want to misquote it, but let us not be weary in well-doing. For in due season, we will reap a harvest of blessing if we faint not. That scripture gives me peace and understanding and strength, knowing that my Father God is so big. And even on the days when I'm tired and I don't know how I'm gonna put this together, and I don't know how I have enough to give to mama, the kids, my husband, the patients, we will reap a harvest of blessing. And he meets us every day with a little bit more strength, a little bit more encouragement, a little bit more blessing. So I want to encourage you. I want to encourage anyone out there in your listening population that's struggling, that you're not alone. And we're all going through it. I don't care if you're a doctor, lawyer, nurse, teacher, daughter, friends, we're all here and fighting this good battle to care for our families and care for them well.
Wow, beautifully put. Thank you so much. Thank you. I will continue to keep you in my prayers as well.
Thank you, Lita, and you are always in mine.
Thank you. Have a good night. And
Thank
thank you again.
you. Thank you for including me. Take care.
Absolutely. Okay, bye.